Here is a summary of the behavioral statements in Domain 2.6 on Pharmacist-Initiated Therapy. This domain has four behavioral statements: A, B, C, and D. Since it has four behavioral statements, you're supposed to provide evidence for at least three. But since there may be instances whereby the evidence that you provide is not good enough evidence, so it's not quality evidence, it's always best to submit evidence for all four of them so that if it happens that one of the behavioral statements is not covered sufficiently by the evidence that you provide, the other behavioral statement evidence is enough to fill in that space. In behavioral statement A, you're supposed to assess and treat a patient. You're supposed to do this by checking subjective information, which is information that you receive from asking the patient using open-ended questions. You're also supposed to do this using objective information. This information is obtained by either checking or observing the patient that you are assisting. You're also supposed to apply the legal requirements of why you are doing this or how you're able to do this. You can look this up in the Pharmacy Act or the Medicines Act. You also are supposed to apply the scope of practice. Now, in applying the scope of practice, make sure that you're applying the latest scope of practice when practicing. Behavioral statement B is about discussing medicine use with the patient. Now, this entails checking preference or obtaining consensus with the patient on the type of dosage form that they want. You're also supposed to check the patient's medical history and you're supposed to check the patient allergies. This may be very important on the type of medication that you provide. You may find that the patient is hypertensive, so giving not ofenadrine, but phenadrine may not be the best option in this. So it's important to check some of these things. Behavioral statement C is about documentation. In documentation, you are supposed to document the interaction or the intervention and that you provided with the patient's complaint. You're also supposed to document the medicine supply, and you're supposed to state the law that relates to the documentation of medicines. This is Regulation 35 of the Medicines and Related Substance Control Act, which was published in August 2017. Behavioral statement D is about referring the patient when necessary. So here it's important to know when you're supposed to refer the patient, and it's also important that you make the patient aware that they can come back for a follow-up in case the symptoms may not improve. Remember that when applying behavioral statement A, use the latest scope of practice.